Hello, my name is Haley Headrick, and Arryanna Jackson and Cammie Willis were also in my group. The topic that we were assigned was safe patient handling. Today I'm going to talk to you about safe patient handling and why it is important in the healthcare field. What is safe patient handling? Safe patient handling and mobility involves the use of assistive devices to ensure that patients can be mobilized safely and that care providers avoid performing high-risk manual patient handling tasks. Using the devices reduces a care provider's risk of injury and improves the safety and quality of patient care. Examples of safe patient handling. Always get help when lifting to prevent injury to you and the patient. I know that hospitals sometimes are understaffed and we don't want to bother others because we know that they have a lot to do, but this could hinder your career tremendously. So whenever you need help, you need to ask for help because it could lead you to being at a desk job for the rest of your life, not being able to work. Definitely not being able to work on the floor if you injure your back bad enough. Another example of safe patient handling is using a Hoyer lift or other lifting devices. We should always try to use equipment whenever it's available instead of ourselves so that we don't get hurt. Using gait belts when lifting patients, having the patient use their walker or other assistive devices because when they use their walker, they put their weight on the walker and it helps to take some of the weight off of you. Having the patient assist you as much as possible. Political importance. According to the American Nurses Association, injuries and musculoskeletal disorders are common in nurses and are often caused by manually lifting and moving patients. The ANA works to prevent injuries and protect nurses and other healthcare workers through safe patient handling and mobility programs and advocacy. Safe patient handling was prompted by ANA's Handle with Care campaign, which began in 2003. 11 states have enacted safe patient handling laws or rules or regulations. These states include California, Illinois, Maryland, Minnesota, Missouri, New Jersey, New York, Ohio, Rhode Island, Texas, Washington, and Hawaii. All of those states, except for Hawaii, require a comprehensive program in healthcare facilities in which there is established policy, guidelines for securing appropriate equipment and training, collection of data, and evaluation. Occupational safety and health programs have fostered research to identify injury risk factors and safety interventions to prevent injuries during patient handling. Evidence-based research has shown that safe patient handling interventions can significantly reduce overexertion injuries by replacing manual patient handling with safer methods guided by the principle of ergonomics. Ergonomics refers to the design of work tasks to best suit the capabilities of workers. In the case of patient handling, it involves the use of mechanical equipment and safety procedures to lift and move patients so that healthcare workers can avoid using manual exertions and thereby reduce their risk of injury. At the same time, patient handling ergonomics seeks to maximize the safety and comfort of patients during handling. Patient handling hazards. Rates of musculoskeletal injuries from overexertion in healthcare occupations are among the highest of all U.S. industries. Data from the Bureau of Labor Statistics shows that in 2014, the rate of overexertion injuries averaged across all industries was 33 per 10,000 full-time workers. By comparison, the overexertion injury rate for hospital workers was twice the average, which was 68 per 10,000, The rate for nursing home workers was over 3 times the average, which was 107 per 10,000. And the rate for ambulance workers was over 5 times the average, which was 174 per 10,000. The single greatest risk factor for overexertion injuries in healthcare workers is the manual lifting, moving, and repositioning of patients, residents, or clients. For example, manual patient handling. Effectiveness and cost savings. Prior to establishing a safe patient handling program, employers often want to know the cost and benefits. According to one large national survey drawn from 53 healthcare systems with roughly 1,000 hospitals in all 50 states, patient handling injuries accounted for 25% of all workers' compensation claims for the healthcare industry in 2011. On average, a workers' compensation claim related to patient handling costed $15,600, and wage replacement accounted for the largest share of this cost-saving average, which was $12,000. So really, the injuries that these workers have come in contact with only costed $3,600, but the companies are having to pay for them to be out of work, and so that's another $12,000 when the injury can be prevented, or a lot of them can be prevented by using safe patient handling. In addition to direct and highly visible costs, there are numerous indirect and less visible costs from patient handling injuries. These are difficult to measure, but they definitely have an impact on a hospital's finances and resources. These include employee turnover, training, the overtime they have to pay workers until they can find a replacement, incident investigation time, and productivity. Patient safety, satisfaction, and recovery times may also be affected if workers are injured during patient handling and repositioning. These indirect costs can increase the total cost of patient handling injuries by 2 to 4 times. For example, a number of studies have tried to estimate the cost of replacing a nurse who leaves the profession, factoring in the cost associated with separation, recruiting, hiring, productivity loss, and orientation and training. These studies place those costs in the range of $27,000 to $103,000 per nurse. This is a picture that we found, and it just shows how hospitals have saved. The first one was Sacred Heart Medical Center, a 432-bed tertiary care facility in Oregon. They saved $305,000 over a 2-year period and reported that the lifts actually paid for themselves in 15 months. The University of Iowa Hospitals and Clinics, a 725-bed comprehensive tertiary care academic medical center, reduced its workers' compensation costs by more than $475,000 and recovered its initial investment in a safe patient handling program within 3 years. Kaleida Health Network, the largest healthcare provider in Western New York, invested $2 million in a comprehensive safe patient handling program in 2004 and realized a full return on investment within 3 years. By 2011, the 5 hospitals within the network had saved $6 million in patient handling injury costs. After creating a culture of safe patient handling, Inglewood Hospital and Medical Center, a 520-bed acute care teaching hospital in New Jersey, reported that it met and exceeded its return on investment goal of 155% within 30 months. The Veterans Health Administration Patient Safety Center introduced safe patient handling programs in 23 high-risk units in 7 southeast facilities. The cost-benefit analysis showed a net savings of $200,000 per year, and the initial capital investment was recovered in approximately 4 years. Northwest Texas Healthcare System, a 404-bed acute care facility and medical center, instituted a minimal lift policy and reported that it nearly recouped the cost of its 3-year program within 1 year. After investing $800,000 in a safe lifting program, Stanford University Medical Center saw a 5-year net savings of $2.2 million. Roughly half of the savings came from workers' compensation and half from reducing pressure ulcers in patients. All of these savings show that safe patient handling is definitely effective and can help the institutions in the long run save money. Political implications actions. We need to advocate for laws and regulations to be made in all states that support safe patient handling. We need to educate employees about safe patient handling and the benefits it has for nurses and patients. And employers should have a patient lifting body mechanics class to help reduce the injuries and costs for the treatment of work-related injuries. They should also have a class that teaches the nurses and employees how to use the different lifting machines and equipment that they have at their facilities. Barriers to safe patient handling. The cost of the equipment can be expensive. Staff are not properly trained on how to use the equipment. Staff feel that they can save time by just doing it themselves. And sometimes they're short-staffed and they don't want to ask other people to help them. Now we're going to talk about a bill supporting safe patient handling. The bill's official position is, in order to establish a safe environment for nurses and patients, ANA supports actions and policies that result in the elimination of manual patient handling. H.R. 4266, to direct the Secretary of Labor to issue an occupational safety and health standard to reduce injuries to patients, nurses, and all other healthcare workers by establishing a safe patient handling, mobility, and injury prevention standard, and for other purposes. In the House of Representatives on December 16, 2015, Mr. Conyers introduced the following bill, which was referred to the Committee on Education and the Workforce, and in addition to the Committees on Energy and Commerce and Ways and Means for a period to be subsequently determined by the Speaker, in each case for consideration of such provisions as fall within the jurisdiction of the committee concerned. Nurse and Healthcare Worker Protection Act of 2015. These are the Congress findings. In 2014, registered nurses ranked 6th among all occupations for the number of cases of musculoskeletal disorders resulting in days away from work, with 11,360 total cases. Nursing assistants reported 20,020 cases in 2014, the second highest of any profession. The leading cause of these healthcare employees' injuries is patient lifting, transferring, and repositioning injuries, which constitute a significant risk to the health and welfare of those employees under the Occupational Safety and Health Act of 1970. Other Congress findings were that the physical demands of the nursing profession led many nurses to leave the profession. 52% of nurses complain of chronic back pain, and 38% suffer from pain severe enough to require leave from work. Many nurses and other healthcare workers suffering back injury do not return to work. These consequences constitute a material impairment of health for these employees under the Occupational Safety and Health Act of 1970. Patients are not at optimum levels of safety while being lifted, transferred, or repositioned manually. Appropriate mechanical lifts can substantially reduce skin tears and pressure ulcers suffered by patients and the frequency of patients being dropped, thus allowing patients a safer means to progress through their care and avoid disabling injuries due to unsafe practices. The development of assistive patient handling technology, equipment, and devices has essentially rendered the act of strict manual patient handling outdated and typically unnecessary as a function of nursing care. A growing number of healthcare facilities that have incorporated patient handling technology and practices have reported positive results. Injuries among nursing staff and healthcare workers have dramatically declined at healthcare facilities implementing safe patient handling technology, equipment, devices, and practices. As a result, the number of lost work days due to injury and staff turnover has declined. Studies have also shown that assistive patient handling technology successfully reduces workers' compensation costs for musculoskeletal disorders. A number of states have implemented safe patient handling, mobility, and injury prevention standards. The success of these programs at the facility and state level demonstrates the technological and economical feasibility of such standards. Establishing a safe patient handling, mobility, and injury prevention standard for direct care registered nurses and other healthcare workers is a critical component reasonably necessary for protecting the health and safety of nurses and other healthcare workers, addressing the nursing shortage, and increasing patient safety. Safe patient handling, mobility, and injury prevention standard requirements. The Safe Patient Handling, Mobility, and Injury Prevention Standard shall require the use of engineering and safety controls to perform handling of patients and to reduce the incidence of injuries from manual handling of patients by direct care registered nurses and all other healthcare workers through the development of a comprehensive program to include the use of mechanical technology and devices to the greatest degree feasible. Where the use of mechanical technologies and devices is not feasible, the standards shall require the use of alternative controls and measures to minimize the risk of injury to nurses and healthcare workers resulting from the manual handling of patients. The standards shall apply to all healthcare employers, shall generally align with interprofessional national safe patient handling, mobility, and injury prevention standards, and shall include the following. The first one is program development. This requires that each healthcare employer should develop and implement a safe patient handling, mobility, and injury prevention program within 6 months of the date of promulgation of the interim final standard, which program shall include hazard identification, risk assessments, and control measures in relation to patient care duties and patient handling. The second one is technology and equipment purchase and management. This requires that within 2 years of the date of issuance by the Secretary of an interim final standard, each healthcare employer shall purchase, use, maintain, and make accessible to healthcare workers such safe patient handling equipment, technology, and accessories as the Secretary determines appropriate. The third one is healthcare worker participation. This requires that each healthcare employer should obtain input from healthcare workers to include direct care registered nurses, healthcare workers, their representatives, and their collective bargaining agents in developing and implementing the safe patient handling, mobility, and injury prevention program, including training and education and the purchase of technology and equipment and necessary accessories. The fourth one is data tracking and review. This requires that each healthcare employer should establish a review program to analyze data relevant to the implementation of the employer's safe patient handling program and shall account for circumstances where safe patient handling technology or equipment were not utilized in accordance with the healthcare employer's safe patient handling, mobility, and injury prevention standard. Each healthcare employer shall maintain the data and findings from their review for at least 5 years. Upon request, each employer will have to make their findings and data used available to healthcare workers, their representatives, their collective bargaining agents, and the Secretary or other federal agencies. The fifth one is incorporation of technology into facilities. This requires that each healthcare employer should consider the feasibility of incorporating safe patient handling technology as part of process of new facility design and construction or facility remodeling. The sixth one is education and training. This requires that each healthcare employer should train healthcare workers on safe patient handling, mobility, and injury prevention policies, technology, equipment, and devices initially and on a continuing annual basis and as necessary. This is important because it will prepare healthcare workers to identify, assess, and control musculoskeletal hazards of a general nature and those specific to particular patient care areas. This should be conducted by an individual with knowledge in the subject matter and delivered, at least in part, in an interactive, simulated point-of-care training and hands-on format that reflects the specific demands of a healthcare worker's duties. We all learn better whenever we do hands-on. We can watch a video, and there's videos on YouTube, I'm sure, of safe patient handling and how to use different devices. And that may be good to look at first, but it's better if you can perform the task in person and be corrected if you're doing something wrong. That way that you know how to use the equipment correctly, and it will help you to prevent injury to yourself. I know that at Fort Sanders, before I started working there, in the orientation, we had to go to a lifting class, and we had to demonstrate that we knew how to do certain body mechanic techniques in lifting patients. The seventh one is notice of safe patient handling and rights under this Act. This requires each healthcare employer to post a uniform notice in a form specified by the Secretary that explains the safe patient handling, mobility, and injury prevention standard, includes information regarding safe patient handling, mobility, and injury prevention policies and training, explains procedures to report patient handling related injuries, and explains healthcare workers' rights under this Act. The eighth one is annual evaluation. This requires each healthcare employer to conduct an annual written evaluation of the implementation of the Safe Patient Handling, Mobility, and Injury Prevention Program, including handling procedures, selection of technology, equipment, and engineering controls, assessment of injuries, and new safe patient handling, mobility, and injury prevention technology and devices that have been developed. The evaluation should be conducted with the involvement of nurses, other healthcare workers, their representatives, and their collective bargaining agents, and their input should be documented in the evaluation. Healthcare employers should take corrective action as recommended in the written evaluation. The last one is the right to refuse unsafe assignment. This requires each healthcare employer to provide procedures under which a healthcare worker or employee may refuse to perform the employee's duties if the employee has a reasonable apprehension that performing such duties would violate the safe patient handling, mobility, and injury prevention standard, and would result in injury or impairment of health to the healthcare worker, other healthcare workers, or patients. In this circumstance, the healthcare worker must have communicated the health or safety concern to the healthcare employer and have not been able to obtain a correction of the violation. There is a handout that we posted, and it has the frequently asked questions, so we will go through those. Why is it important to develop national safe patient handling and mobility standards? Every day, nurses and other healthcare workers suffer incapacitating and often career-ending musculoskeletal disorders. The most common tasks that leads to injury are manual lifting, transferring, and repositioning patients. The next one is, aren't nurses and other healthcare workers taught the proper mechanics for lifting and moving healthcare recipients? Healthcare professionals usually have been taught proper body mechanics and other techniques for manual patient handling. Nevertheless, decades of research shows that good body mechanics are not adequate to prevent injury. Musculoskeletal disorders are often increasing, developing over time, even though healthcare workers may not immediately feel the effect of manual patient handling. There is no such thing as safe patient lifting. What factors did the Safe Patient Handling and Mobility consider in emerging the standards? The factors that were considered is that these would be universal in all settings, realistic and attainable, evidence-based and outcome-focused, and flexible. Are these standards for patient handling in federal and state laws and/or regulations? Only 10 states have enacted safe patient handling and mobility laws. However, like I talked about before, a lot of states practice safe patient handling. They have classes, like the class at Fort Sanders, that teaches you how to move patients correctly without putting the strain on your back. They instruct you to use your knees more. And they will teach you about the different equipment that they have at the facility. So I'm sure that other hospitals have classes that teach about equipment that is used in their facilities. They may just not have laws made in their states for this. How are the standards being used by healthcare facilities and organizations? The standards provide a framework to help healthcare facilities and organizations establish culture of safety. When an organization establishes a culture of safety, safety is emphasized as a high priority. How do safe patient handling and mobility programs improve healthcare work and healthcare recipient safety? These programs can drastically reduce healthcare worker injuries. Additionally, there are benefits for healthcare recipients such as improved quality of care, improved mobility outcomes, and a decrease in conditions acquired as a result of hospitalization. The standards are evidence-based. In other words, the principles and guidelines that make up the standards have been demonstrated through research to be effective in reducing injuries and other negative outcomes. What are the financial benefits of adopting this program to a healthcare facility or organization? Across the board, safe patient handling mobility programs have been shown to reduce costs attributable to workers' injury compensation claims, missed and restricted duty work days, healthcare recipient falls, pressure ulcers, and staff turnover due to work environment risks. This aspect of patient care typically has been referred to as safe patient handling. What is the significance of adding the term mobility? The word mobility was added to include the emerging evidence-based concept of advanced mobility for the patient as an end goal rather than simply the handling of patients. Mobility is very important because if we don't keep our patients mobile, they will continue to lose their strength, and more of the work will be put on the nurses and other healthcare workers. Even if the patients aren't able to be mobile or get up and walk, we still need to help them exercise their arms so they can grab bed rails to help them turn, anything that will help the nurses. At the end we included this discussion, and you can reply to it in the discussion post, but we just have a case scenario. Mr. G had multiple sclerosis and was cared for at a hospital by 2 employees. He had full use of his arms and hands, but little strength in his legs and feet. He weighed 165 pounds. For his hygiene, the healthcare workers had to wash him in bed. One healthcare worker would roll Mr. G towards her, and the other would wash his back. Holding the patient was uncomfortable for the worker and caused lower back pain. What actions could help prevent the worker from getting an injury? These are the references that we used. Thank you.